this life flight, a notorious bend claims another victim.
It looked awful when I got here. Yeah, I think he's probably lucky to be alive.
An emergency mission, but is it too late?
I don't think ahead about what we might need in case things went a bit nasty.
And a chainsaw accident puts a life at risk.
It's quite scary. It always is when you see someone hurt.
When emergencies strike, time, distance, and the men and women of life flight can be the difference between life and death. This is Life Flight. A driver has rolled his truck and his life is in danger. Pilot Dean Herrick and crewman Julian Byrne are heading towards the South Island as further mission details come in.
Got a location yet? Yeah, Clarence River.
Truck driver Steve Poley is severely injured and help is far away. Intensive care paramedic Nigel Stevens is getting updates from witnesses on scene.
So we've been responded to the top of the South Island, North Kokora. A truck has rolled over with persons trapped. We're not going to know exactly what's going on until we get down there.
The accident location is a notorious black spot. The Westpac rescue chopper has been there many times before.
It's just quite a nasty stretch of road when we get down there. It's on a corner, and if you cross the centre line at 100k, it can cause a few issues, especially with some of the heavier traffic down there. Bit of activity at 12 o'clock there. It's exactly what we were having last time. Comms Air 1 Wellington located.
Nigel approaches the accident site. The truck has rolled onto its roof and back onto its side, stopping just short of the train tracks. Steve pulled himself out of the wreck, where local doctor Brett Mumford completed a quick assessment.
So I got an obvious head injury and he's complaining of neck pain.
So obvious head injury, is there any...
Yeah, it's bloody.
Bloody?
Yeah.
Police officer Alan Purtle has begun his investigation.
According to witnesses, the vehicle's come down the highway and he's come into this corner. Trailers left the road first and dragged the truck in with it.
Inside the ambulance, Steve's pain is increasing.
First of all, where's the most pain? In your neck.
At the base, the Life Flight air ambulance is being prepped for an immediate takeoff to help a critically ill child who is being picked up from Wellington Hospital. 4-year-old Joe was born with a malformed heart. He recently had a monitor inserted, and 2 days ago it alerted doctors that Joe's heart had stopped, and Mum Rebecca is worried.
So I don't know if it's been happening all the time, or or if it's something new that's
A growth spurt is likely to have triggered the cardiac arrest, and the 4-year-old is unaware that he is at risk of more.
Do I have to leave these stickers on?
Yeah, because what do they do? What do they look at? Do you know? Can you tell me? What goes boom, 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 boom in your chest? It's very special. You know? Your heart.
No, I don't know.
You don't know.
Flight nurse Nikki Williams and crewman Matt Anir are concerned that once airborne, the altered pressure could cause problems for the child.
There's pressure changes in the aircraft, so for different reasons, the oxygen level that we usually breathe can be a little bit lower, so we just need to keep an eye on that.
Joe has been in and out of hospitals all his short life, but is too young to understand the seriousness of his situation.
This is gonna be fun.
Okay.
Sir, you're driving.
The journey in a real ambulance is just the start for Joe. The plane is ready and waiting, and Joe is quick to make friends with pilot Sydney Elwell.
Really? Oh dear. Just keep your boxing glove nice and close to your side there, eh?
Joe's got a lot of fight in him, and he'll need it all to make it through this latest test.
the cardiologist was pretty adamant he'll need a pacemaker, which is distressing and comforting. 4 is definitely way too young for a pacemaker. But yeah, that's just Joe.
With everyone loaded on board, Sid and pilot Ian Puri look to their young co-pilot for directions.
We are clear for takeoff.
70 knots, line control, fuel control.
The 4-year-old doesn't know he may have to have open heart surgery, and Nikki is keeping a close eye on her patient's alarming new symptom.
We just noted earlier that his blood pressure was on the low side. Just trying to think ahead about what we might need in case things went a bit nasty.
Back at the truck crash site, Nigel is concerned driver Steve has suffered severe neck injuries.
Yep. You can have a quick look around your head here. Do you know what day it is today? Monday. Monday?
Yeah. Steve can't recall the correct day. The Whangarei-based driver is far from home and may have a brain injury.
Neck pain still quite sore? Yeah. Right, what would you give it out of 10, 10 being the worst pain and 0 being no pain? 8. An 8, okay. Good, yep. Nice and small. We're going to warm you up in a minute, mate. We just need to get to your arm, okay?
Steve's pain is increasing, but local doctor Brett is struggling to find a vein for intravenous access.
We're going there. Yeah, not so much.
Firefighter Peter Ford inspects the wreck of the cab.
The driver's seat's up there, he's obviously fallen down there and he's pushed this window out. And he was laying here when we got here. So he's pretty sore, but lucky, I would say.
Brett makes several attempts without success. Nigel can't airlift the truck driver without the ability to administer medication.
Just securing him now. We need to get an IV in.
Okay, well, is IO or?
The team have one option left. Nigel must drill a hole into the bone of Steve's leg to deliver medication into his bone marrow.
Sometimes with patients who are shut down peripherally, you can't get an IV into a vein. So what they have is an intraosseous drill, which will drill straight into the bone, okay? And then you can put medications into the bone that way. So don't often use it, but it's a very effective way to get pain relief into the patient.
A truck driver has careered off the road and rolled his 16-wheeler. The Life Flight team have had to drill into his shin to get intravenous access for medication.
Thanks, mate. That's it.
It's done. It's done. It's done. Drugs in there through it and it'll make it feel a lot better, okay?
Steve could have a crushed vertebra and may suffer permanent spinal damage.
Cheers, guys. I've got to slowly move around.
Local Dr. Brett was the first medical responder on scene.
Yeah, it looked awful when I got here. But he had what looked like a pretty good head injury and complaining of neck pain as well. Yeah, I think he's probably lucky to be alive.
A few bumps here, buddy. Be overshot.
Good. Thanks, guys.
Just give me some allergies here. You won't feel it for long. You won't long. You won't feel it for long.
Oh, mate, it's sore.
So I'll put some anesthetic with it, okay? It's listening.
Sorry, bud.
No, look, you're being very brave about it, okay? Nearly there. It's going to go numb in a minute. Right, good to go, Jen.
In reality, helicopter transport was this guy's only option to get him through to a hospital to get his injuries sorted quickly.
Steve was facing a 3-hour road journey by ambulance to Christchurch. But the Life Flight crew have reached Wellington Hospital within 40 minutes, where the emergency team begin their assessment.
The chief complaint is C-spine tenderness, central. He gives that about 8 out of 10 at C.
Steve has signs of a significant head injury, and concerns are growing that the damage to his neck is serious. The Life Flight air ambulance is over halfway on its journey to Auckland with 4-year-old Joe, whose weakened heart could stop at any moment.
What's wrong, my love? That was very sudden.
The youngster underwent open heart surgery at 10 days old. Now, his heart is only beating at half the normal rate, and Nicky is concerned.
They've got what we call a sinus arrhythmia, so instead of your heartbeat being really regular, it's irregular.
Joe has been in and out of hospital all his short life, and Mum Rebecca is concerned his distress will escalate.
At Starship last time, the goal was to get him through happy and without any anxieties for going back. Because open heart surgery can be a bit of a long haul.
Despite a slow heartbeat and low blood pressure, Nicky can't find a medical cause for Joe's distress. Crewman Matt comes to the rescue with some in-flight entertainment.
A lot of kids movies on the iPad, so yeah, definitely keeps them occupied and at ease.
Often they've been monitored overnight and they're really tired and they're just over it.
Because he's such a happy kid and he copes so well with all the stuff, it is hard when he gets upset.
In Wellington Hospital, Dr. Sarah McCabe and her emergency team are assessing the damage Steve sustained when his truck rolled on the open road.
On through again. 1, 2, 3. Well done, Stephen. Relax, Stephen. Just relax.
Steve was left dangling from his seatbelt in the overturned truck, and his efforts to get out of the cab may have caused more damage to his vulnerable neck.
Feel, Stephen? Is that sore? There. Yeah, there.
Sarah is concerned Steve could suffer long-term paralysis from his neck injury, but she can't rule out the possibility he has significant internal injuries and orders a CT scan.
You're on. You okay? Is that okay?
He can have bleeding into his head, and that can change very quickly. So he might seem like he's okay 1 minute and then deteriorate very, very rapidly. Things can go wrong.
The truck driver's boss, Stephen, has taken the first flight from Auckland to be by his worker's side.
Hey, your partner's on the way down. Okay, just relax, mate. Just relax. All right. It's good to see you. It's good to see you up and going, bro. It's okay. All right. It's okay. I've been where you are, and I'll see you through it. All right. You're all right. You're okay.
Stephen was in a horrific crash when he started as a truckie over 2 decades ago and knows what Steve's going through.
It's what we do. And we do our best, and just sometimes we lose the battle. Your goatee looks really messy like that. Oh dear. I'm just glad you're here, mate. I really am. I want to thank Lifeline for everything they've done. It was really quick. He was here in time to be looked after and kept in the real world.
The x-rays and scans have come back, but the news is not good.
There's a bit of a question mark over a potential problem in his neck. It's not completely clear on the scans, so we're going to have to ask the orthopaedic doctors to have a look at his neck.
Back at base, Dean and crewman Colin Larson are lifting off on a mission to try and save a man badly injured in a chainsaw accident on a remote farm 120 kilometres northeast of Wellington.
Oh no, we've got a location yet. Actually, I might get comms just to drop us some GPS coordinates.
The man is in a serious condition. Intensive care paramedic Hernan Holiday is the stricken farmer's best hope.
Could be quite serious. Chest injuries could develop from just a pain or a bit of shortness of breath to a catastrophic event and going downhill very fast. We are equipped to treat the worst case scenario.
The life flight team are trying to locate a man on a remote farm who has been seriously injured in a chainsaw accident.
They did say that they were going to put a quad bike or something out in front, I think. Might be it in that paddock just in the 1 o'clock there. Comms Air 1 Wellington located. Nice. Tails well clear, left well clear.
You know the partner?
Yeah.
What happened exactly?
We were felling a tree,
yeah,
and it fell the wrong way.
Okay. He tried to escape?
Yeah.
And where?
Just caught him.
Where? Do you know where?
Caught him across here.
Anne and Jeff farm sheep on the Wairarapa coast, but the isolation the couple love makes it a dangerous place when things go wrong.
He was in pain and just couldn't breathe.
Yeah. Okay, and where is the main pain? All over here?
Yeah.
Okay. Try to breathe in and out through your mouth for me.
Neighbour Kevin saw the tree topple.
Just sort of cutting it down from up here. Just cut it through, it started to move away from it, and it just sort of dropped the odd angle and caught him from behind. It was quite scary, it always is when you see someone hurt.
Jeff thought he'd taken the right precautions, but something went very wrong.
Yeah, I tried to run away from it, but it was too late. Clonk. I was on the ground, face down.
Let's see if I'm gonna require some pain relief, hey?
Yeah, that'd be good.
Several ribs could be broken, and Hernan is concerned Jeff may have a collapsed lung.
Could get quite serious, more when we are flying. That could expand, and patient can go downhill very, very quick, and that we don't want that in the helicopter.
Yeah.
Worst case scenario, I will have to put a little needle in your chest, okay?
The Life Flight fixed wing crew touched down in Auckland with 4-year-old cardiac patient Joe. The 4-year-old must have tests to discover why his heart stopped beating 4 days ago, but Joe is unaware of how close he came to dying.
Nice and still, and we'll take a reading.
It's squeezed tight again.
Squeezing your arm, isn't it?
At 10 days old, Joe was rushed into surgery as a newborn to fix a malformation of the arteries in his heart, but doctors have warned that as he grows, the arteries will have to be operated on again.
It's sounding likely that he'll have another open heart surgery. When? Don't know. It's heartbreaking. Yeah. To have to do that. Have to do that again.
Underwater, I can almost do backflips and dip.
This time he'll be able to tell us how he feels and how awful it is, I suppose. Yeah. So to have to do that again and essentially put him through that again is pretty awful.
More tests will be needed if Rebecca's fears about open heart surgery are to be confirmed, but whatever the result, Joe is ready for the fight.
Good luck with that. I'll come watch you for your heavyweight fight.
Back in the Wairarapa, an attempt to cut down a dead gum tree has left Jeff struggling to move, but the pain may be masking a more serious condition.
So my concern is that one of your lungs is probably a bit collapsed, okay? Because the problem with going up in the air is that the air expands, you know, we don't want any more thorax.
Hernan cannot detect any evidence of air in the chest cavity, but as Jeff gets ready to leave, his situation declines.
Have you got some more pain relief? Pain levels come back up again, yeah.
Look like you have at least one fractured rib, eh?
And I'd hate to feel what 3 felt like.
The pain medication takes the edge off Jeff's distress, but the farmer is eager to get on his way as soon as possible.
Have we got a pillow?
It's hard for Anne to see her partner of over 20 years in pain, but Jeff's biggest concern is his mate's ability to help get him into the chopper.
Just remember, he's only a farmer. He might drop me.
Alrighty. Stand by one.
The team are airborne, but pilot Dean must keep at a low altitude to prevent any air trapped in Jeff's chest cavity from expanding and collapsing his lung.
Yeah, the problem with this pneumothorax is that can get wrong very rapidly, so the patient can get in a bad way very, very, very quick. Transporting a patient with that kind of pain, you know, probably more than an hour by road to hospital, we did it in under 15 minutes. with a very good pain control.
Yeah, all set for landing back there?
Yeah, all set.
Cool.
X-rays will help determine the extent of Jeff's injuries, but for Anne, the relief has already begun.
Thank you for Life Flight. Very, very much appreciated when you live rurally. And we just keep fingers crossed that everything's okay now.
3 days after Steve rolled his truck on the open road, he has been diagnosed with broken bones in his neck and arm. Steve's doing well, and surgeon Anantha Narayanan has good news.
We're transferring you to Auckland, closer to home, but we're really glad with the progress that you've made here in hospital.
Steve is heavily medicated because of his pain, but the truckie has avoided surgery and is upbeat about his future.
Think positive, think ahead. The first stage of the recovery is getting out of here and getting home. And
4-year-old Joe underwent open heart surgery the next day to repair the arteries of his heart, and also had a pacemaker fitted to prevent further cardiac arrests. He returned home, ready to start school. Tree-felling victim Jeff was cleared of having broken ribs, but his injured foot kept him confined to bed rest for a week. He is now back on the farm and has promised Anne to be more careful next time he has the chainsaw out.